All right, welcome class 2. This is lecture on chapter 5, which is for week 3. And this chapter is over the basic human needs. So you guys are going to learn to love Maslow's. And you're going to learn to love Maslow's backwards and forwards, upwards, downwards, and whichever other way there is. So what is Maslow's hierarchy of needs? Maslow's defines the basic needs of all people as a progression from simple physical needs or survival needs to more complex ones called aesthetic needs. You must meet survival needs before you can progress to the more complex needs. So progression from physical needs to aesthetic needs is, remember, your physiologic needs takes precedence over any other higher level needs. So, you have to have oxygen. Without oxygen, you can't breathe. And if you can't breathe, what else matters? You got to have water and fluids. You have to have food and nutrients, elimination of waste products, sleep and rest, activity and exercise. Remember, those physiologic needs must be met to sustain life. Secondary needs are met to give quality to life. So then we move from our physiologic needs to our safety needs. Safety needs are both physical and psychological needs, as freedom from harm, financial security, healthcare, shelter. Then we move on to love needs, which are social needs, spiritual needs. Esteem needs are your self-esteem. And then self-actualization needs is where you've reached your full potential and you're able to plan ahead. So remember that you must meet your priority needs to sustain life, and your secondary needs are met to give quality to life. On page 48 of your book, there are two different figures. So figure 5-1 is a hierarchy of needs according to Maslow's. Figure 5-2 is a hierarchy of needs and nursing interventions. And, you got to remember, nursing actions and Maslow's hierarchy can take many different forms. So, I just want to focus on, we'll start and we'll go through each one of those separately. So, but first off, I want to address regression. Regression is focusing on a lower level need that has already been fulfilled. And this is common in illness or injury. So, and examples of that is a client recovering from an illness will focus their physical and emotional energies on recovery, the physical needs, before returning to employment, their security needs. Or individuals in pain will revert to being concerned about personal appearance or relationships with others only after their pain has been relieved. So I want you to know what the definition of regression is, and just remember those two examples that were given. So question, critically ill clients will continue to seek to fulfill needs in the order of Maslow's theory of hierarchy. True or false? That is false, because critically ill patients will usually regress, and that is they will focus on a lower level need that has already been fulfilled before they revert to focusing on their higher level needs. So basic physiologic needs. This all starts on page 49 in your book. So oxygen, like I said, is the most essential of all basic survival needs. Without oxygen, we can die within a matter of minutes. So, as nurses, we are going to constantly evaluate the oxygenation status of our clients. Remember, for example, in the book, as it says, emphysema, asthma, paralysis, or secretions may make breathing difficult. So remember that, oxygen is our first and foremost need that has to be met. And then water and fluids. Water is necessary to sustain life, because the body can only survive a few days without water. And examples of conditions in which individuals may require assistance to meet their fluid needs include unconsciousness, inability to swallow, and severe mental illness. So what can we do to assist in these conditions? We can measure their I's and O's. We can weigh the client daily. We can observe IV infusion of fluids. And then we need to meet their food nutrients. Of course, nutrients are necessary to maintain life, although the body can survive for several days or weeks without food. Elimination of waste products. Elimination is essential for life and comfort. The body does eliminate waste in a lot of different ways. The lungs eliminate carbon dioxide and water. The skin eliminates water and sodium. The kidneys eliminate fluids and electrolytes. The intestines discharge solids and waste. So, we do have to pay attention to all of the elimination of waste products. Sleep and rest. Sleep and rest are also important in maintaining health. And so, the absence of sleep is not immediately life-threatening, but it can cause various disorders if it is allowed to continue. So, there's different ways that nurses can help, clients to get enough sleep and rest. They can do back rubs, not like we used to do. We used to do it all the time. Now there's not have as much time to do those. You can provide them warm milk, and then there's also medications that you can provide to them. Activity and exercise. Of course, activity, stimulates both the mind and the body, and exercise helps maintain the body's structural integrity and health by enhancing circulation. So, mobility is not necessary for survival, but some form of exercise is needed to at least try to maintain that optimum health. So, even after surgery, you want to encourage a person to get up to walk after surgery. We can teach clients how to use walk with crutches. We can also just do passive range of motion if they are unable to get out of bed. Also, one of their other basic physiologic needs is sexual gratification. And what we have to remember, the need for sex is not vital to the survival of the individual, but it is vital to the survival of the species. So, sometimes you may have clients who have different sexual issues and that they may want to discuss with you. So you just have to learn, what their concerns are, and talk to them, provide education for them. A lot of times a client may have issues especially if they're recovering from surgery. They may be concerned about the physical effects of sexual intercourse on a healing incision. So just remember that age and physical disability does not eliminate a person's desire for sexual activity. And then temperature regulation. Several factors can affect and threaten the body's need for temperature regulation. So, our body has different mechanisms that it assists in trying to maintain that body temperature. We can shiver, we have goose flesh, perspiration. We will assist clients to meet the need for temperature regulations by monitoring their temperature and providing treatment for any effects of thermal damage. So remember, an oral temp is usually 98.6 is the average, or 37 degrees Celsius. And I have already talked about all of these slides, so I'm just going to flip through these ones because I'd already talked about those. Security and safety. At the second level of Maslow's hierarchy of needs, there are both physical and psychological needs. Freedom from harm. We need to remove threats to the client's safety. We need to take preventive measures. And we need to explain procedures and treatments and or medications. So Remember, we have to remove threats from the client's safety, to their safety from their environment. It could be, like using a night light. It could be maybe they have throw rugs, that they may trip over, or, they may have Alzheimer's and they have a gas stove and they like to turn on all the buttons, all the knobs all the time. So we have to remember we have to remove threats to safety from their environment. We also have to remind them to lock up poisons in homes, especially if there's small children around. So, we have to remember to take all those types of preventative measures. And then abuse, we are to report any suspected abuse to the proper authorities. Abuse can be spousal abuse, partner battering, it can be child abuse, it can be rape, it can, remember, physiological abuse. Physiological abuse may have longer lasting scars than physical abuse. And as nurses, we are legally bound to report any suspected abuse in clients, and it must be reported immediately. And on page 50 in your book, the nursing alert, it says if you, as a nurse, do not report suspected abuse, you could be subject to arrest and civil penalties. We didn't talk about love, affection, and belonging, so we need to talk about that real quick. So love, affection, and belonging are societal needs, are addressed in the third level of Maslow's hierarchy. So, when a person is injured or ill, they're often separated, from their family and friends, especially nowadays, right now with this coronavirus going on, everybody's socially isolated. So, the thing of it is we can assist these people by encouraging visitors cards and telephone calls, and by visiting with the client whenever possible. So their spiritual needs. Many people believe in the higher power. So this power takes many different forms. So, we can assist them to worship services. We can provide reading or video materials, or we can contact their clergy person, or we can also contact the chaplain in our healthcare facility. And then self-esteem. Self-esteem is your self-image or self-respect, and is related to the person's perception of themselves. Those who are ill or injured or who undergo surgery may have altered levels of self-esteem. The nurse will need to help such clients regain positive self-esteem by we can reward and encourage an individual's progress in rehabilitation. We can allow them to perform as much self-care as possible. And we can also observe these clients for symptoms of regression, depression, or chemical dependency. So, there are different ways that we can help our clients help regain their positive self-esteem. So question, a nurse can help a client in meeting self-esteem needs by assisting the client to get enough sleep, explaining the procedures, treatments, or medications, rewarding the client's progress, feeding the client, or reporting signs of abuse. It is C. By rewarding the client's progress, a nurse can help clients to regain positive self-esteem by encouraging independence and consequently rewarding progress. And then at the top of Maslow's hierarchy of needs is self-actualization. And self-actualization is the person has reached their full potential. A nurse can help clients obtain self-actualization by assisting in achieving lower level needs and acknowledging accomplishments of the individual. So by assisting to achieving lower level needs, think of it this way is first, we can elevate the head of the bed, which is safety. We can help with their shoes. like non-skid rubber sole shoes would be safety. Provide measures to help them sleep is physiologic. And sit with a client who has received a terminal diagnosis, meets their love's needs or esteem. So those are different ways that we can assist in helping a client achieving their lower level needs to obtain self-actualization. So our basic and aesthetic needs of individuals who are homeless, terminally ill, or have no source of income. You think about this, people in this situation must find food and shelter not only for themselves, but for their children as well. These individuals are more concerned with meeting their primary rather than their secondary needs. They become ill first and then they seek health care. And such behaviors are concrete methods of dealing with illness or emergency responses to the stimulus of illness. So community or societal needs. The community has basic needs concerning the welfare of its residents, public health care measures, immunization programs, access to health care is the Affordable Care Act, maintenance services, water, electricity, waste disposal, environmental concerns, energy sources, pollution, safety is police, highways, and emergency services such as 911, service, ambulances, disaster preparedness drills. So, remember that among these needs are public health measures which offer immunization programs. And that is chapter 5, and according to Maslow's basic human needs. Now, I want you to really look through on page 4, starting on page 48, and really review the basic physiologic needs. Because as you think about it, some clients may have difficulty with oxygenation, which that could be a client who is a quadriplegic. Also, some clients have difficulty, maintaining water and fluids, making sure that it is what they have is necessary to sustain life, especially like the severe mental illness, because they forget that they need fluids so I really want you guys to pay attention to the basic physiologic needs and really know those. So read page 40, it starts on 49 to page 50. If you have any other questions, please don't hesitate to send me a quick email, and I will I will get back to you as quick as I can. Thanks, bye.